adult or a loved one, you may be considering home health care. Now, as you do, you need to know you're getting the correct answers and asking the best possible questions. This morning, Dr. Alicia Arbaje with Johns Hopkins is here with some great answers. If you haven't thought of all those questions just yet, Doctor, thanks for coming in today.
Thanks for having me.
Real quickly, this is something families have to consider as those older adults get into those later years and they can't care for themselves. Is that the case?
Right, and it's something that it's a hard decision to make sometimes, but it's important to think about that you might be eligible, or the loved one might be eligible for help at home. And home health care can be one way to really help older adults stay independent at home and keep them out of the hospital if they don't need to be there.
Simply put, what is it? I mean, what exactly is home health
There's
care?
a lot of confusion about what is home health care. So home health care is having a health care professional come to your home, usually 2 or 3 times a week for a short amount of time, to help you with different activities that you might need and different skill sets. And it's usually a team approach, so it's a nurse that comes and serves as your case manager and coordinates care with your primary care doctor, and that nurse can bring in other people to help you take care of you as well.
Now, the end goal in this is to keep that older adult as independent as possible and in as comfortable of a setting as possible,
That's
right?
exactly right. And what some people don't understand also is that it's really about education. The nurse and that nurse team is there to help teach you how to take care of yourself and help teach your family how to help take care of you. So they're there to do things for you for a while, but also to empower you to learn how to take better care of yourself.
At what point do you start maybe talking to a doctor about this?
Right.
When do those questions start coming in?
Right. So my advice is to ask your doctor if you're concerned about a few things. So one, if you've been in and out of the hospital, anytime you're in the hospital, that means there's been a change in your health. So that's a time when home health might be important. So if you've been to the hospital, or if you've been diagnosed with a new medical condition or given a new medication, again, anytime that there's a signal that there's a change in your health, that's the time when you may want to consider having someone come at home. But a couple other times that are important also are if you're having difficulty walking or if you've just fallen. That's a sign that something else might be going on, and again, a home nurse can come and get you some therapy as well.
Now, as you're talking to a doctor about this and getting the necessary advice and consult from that end,
right,
how do you get the older adult ready for this change that's going to be coming into their life? Because this is a lifestyle change for them as well.
Right, and that's an excellent point, because sometimes people feel a little uncomfortable about having someone come into the home for safety issues or trust issues, but also because it might feel like they're no longer independent. So this needs to be a decision amongst the family. It's not something that can be forced on the older person. But again, emphasizing that piece that this is usually a short-term intervention. It's usually for a few weeks until the person is sort of back on their feet, and that it's, again, the whole goal to try to keep them as independent as possible.
A couple of websites people can check out to maybe get some answers to these questions. If they have more questions beyond this, where can they go?
Right. So one website that's really important is going to the Medicare website, medicare.gov, and if you search under home health, you can look at what are the questions you should ask to see if you're choosing the right home health care agency. And also, there's a checklist there for what other things you might want to think about. And Medicare is the main payer for home health care in older adults, so that would be the first place to go. And then there's the Visiting Nurse Association of America that can help you pick a home health care agency in your area.
All right. Dr. Alicia Arbaje, thank you so much for the time.
Thank you.
Again, that website is medicare.gov. Go there, check it out, find the much-needed frequently asked questions so you can start getting the answers you need. Thanks a lot. We'll have this